In 2017, Aurum Institute Ghana, a subsidiary of the South African-based Aurum Institute, began its operation in Ghana, a non-profit organization whose mission is to generate evidence for policy and translate policy into practice to improve the health of communities worldwide.
Aurum Ghana over the past 5 years has encountered numerous challenges, but through perseverance, determination and hard work, many of these challenges have been overcome.
Aurum came through Ghana to source the inclusion of Ghana as one of the countries where this multi-country intervention was going to take place, largely because Ghana had a very successful TB program, and in spite of the fact that we were relatively, compared to the other country, a low-burden TB country based on our national TB prevalence. To set up the country office, Aurum contracted me. At the time, I was the deputy program manager of the National TB Control Program, to help them set up the country office.
Aurum Institute Ghana has collaborated and partnered with several stakeholders in the implementation of all its projects and interventions. Key amongst them are Ministry of Health, Ghana Health Service, and the Ghana TB Voice Network.
With Aurum, we have partnered very well. We commenced when we had a TB Reach with 6 partnership, where together over 50 private facilities, we found the missing TB cases.
Aurum, as an implementing partner, is focused on promoting TB preventive therapy in Ghana. So as a project, we work very closely with them to be able to implement what we have adopted as a policy to ensure that we prevent tuberculosis amongst persons living with HIV.
TB Voice Network has worked with Aurum on several projects which include the TB Reach websites, where we involve community volunteers to finding the missing people with TB within the communities within Ashanti region, and specifically in 4 sub-districts in Ashanti region, which is Minshia, Bantama, and then Minshia North, and then South, and Bantama.
In 2019, Aurum implemented active TB case finding intervention in collaboration with the national program, that is the National TB Control Program, which was a funding that was received from Stop TB Partnership to actively engage private health facilities and national health insurance to find TB among this vulnerable population. The intervention was carried out in 2 metros, densely populated metros, that is Kumasi and Accra Metro. Now, this intervention seeks to engage private health facilities to find TB cases, engage pharmacies and over-the-counter medicine shops to find TB cases, search for TB cases in communities, and also carry out contact tracing of diagnosed TB persons. In the private facility intervention, we engaged 52 private health facilities where we installed 4 gene expert machines for TB diagnosis. Also, we trained over 300 healthcare workers, doctors, nurses, laboratory scientists, to be able to screen and then diagnose TB and manage as well.
In 2019, the project was responsible for 3.8% of the nation's TB case notification. Aurum Institute Ghana is expanding up TB preventive therapy in Ghana, utilizing a shorter, less toxic regime called 3HP through the flagship Unit 8-funded Impact for TB initiative.
The Impact for TB means that we want to increase access to a shorter regimen for TB prevention, and specifically we are introducing 3HP, a 3-month regimen of isoniazid and rifampicin, and this is a combination of TB medicines that is given to prevent TB in people who are vulnerable to develop the TB disease.
Ghana was one of the first nations in the world to introduce the patient-friendly fixed-dose 3HP in April 2021, and since then, it has enrolled more than 6,000 at-risk patients in TB preventive therapy.
Compliance is of a major concern to us, because the more the
medicines they take, the higher the chances that they may not comply, they may forget. But this has been comprehensively tackled by Aurum.
Concerning drug efficacy, 3H has the same efficacy as isoniazid preventive therapy. In terms of drug completeness, patients are able to complete more like previous drug preventive therapy.
Patients appreciate it and are able to adhere and also complete it. So the completion rate is very, very high. And because of the pill count, it's very, very minimal as compared to that of the other TPT.
Patients seeking TB prevention have witnessed tremendous difference in their health.
Misha says, minimum 3 HP. No. Ebwa mi bebre because beginning na me pese menom. Nanso no nurse for no enemy kasai enemy fa atretrim. Emma mete me ho asese esese menom. The sign said, me numa ebeboa me ankasa. Se nebe ya minya TB yare ni.
Misha si enu 3 HP edrolu. Ifaso aminya wa husu se aboa mi ametimi me numa edrona minya TB yare ni bi.
We advocating within our community members to make sure that the uptake of TPT is scale up within the community members, which include the persons living with HIV and then TB. Index of the contact of TB clients as well in the household, so that we can put them on TPT, with specifically on 3HP, introduction of 3HP into the country as well.
The catalyst that was provided through our collaboration with Aurum has led to a rapid scale-up of TB preventive therapy in the country. In fact, when we started, we were only covering a few numbers. People, the number of persons living with HIV who were receiving TB preventive therapy was very low. But now, demand creation has increased, and we have therefore increased the numbers, and we're scaling up. This has led to an increase in the need for the medications.
Impact for TB, where we scale up TB preventive therapy to more than 5,000 patients, has been very remarkable.
The target for the intervention was to collaborate with the national programs on TB and HIV to provide this preventive therapy to people living with HIV and contact of TB positive persons, especially looking at children who have TB positive persons in their home.
As we continued implementing interventions to prevent TB, the COVID-19 pandemic brought to halt healthcare activities and program implementation.
Aurum Institute approached the Ayawaso West Health Directorate with an offer to support us through the pandemic, offering us sought after things at that time, such as the PPEs, including the face masks, the liquid soaps and all, and also supported us with a fuel vehicle with a paid driver to support our contact tracing activities.
The for COVID-19 program is a unitaid funded intervention where we and partners in the government of Ghana and in the international health organization community are working to bring COVID-19 testing and treatment services to the Ghanaian public where they need the care and at a price they can afford. We are doing this through partnerships with organizations like the WHO, the Clinton Health Access Initiative, the Ministry of Health on the Government of Ghana side, and its agencies such as the Ghana Health Service and the National Public Health Reference Lab.
As part of continued efforts to supporting the national response, Aurum Institute Ghana is implementing the Unit Aid-funded Impact 4 C19 project to reduce COVID-19 mortality through accelerated diagnostic tools and therapeutic options scaled up.
So far, what we've been able to do includes expanding out antigen testing trainings to the central and eastern region, where we've trained now over 100 healthcare workers on how to use that technology. We also support the country to forecast its needs in the COVID-19 space with respect to treatments and testing all the way through the end of this year. We're currently working on developing an evidence generation review workshop where Government of Ghana staff and agency officials can get a chance to review new WHO recommendations about COVID-19 treatments.
In its short existence in the country, Aurum Institute Ghana has made significant impact through the projects implemented. The 4 GenExpert machines installed during the TB Rich Wave 6 project has improved TB diagnosis and continues to contribute to national TB notification.
Before the GenExperts, when we take the X-ray, sometimes many occasions we are doubtful whether it is TB or something else. But with the coming of the gene experts and with our partnership with Aurum, they decided to bring us the gene expert machine. So the coming of this gene expert machine has helped us tremendously.
The refurbishment of 11 human and animal health sentinel reference and surveillance laboratories to the antimicrobial resistance AMR project is very significant in contributing to AMR surveillance in Ghana.
Aurum Institute had 3 key mandates for this particular project. One, we were supposed to refurbish 11 sentinel sites, which cuts across from the northern region of Ghana right down to the coast in Accra and some other coastal regions. And also we were supposed to install and purchase specific equipment that would advance AMR work in all of these sites. And finally, we're supposed to ensure the availability of consumables and reagents that would be used for this particular project.
Department of Medical Microbiology actually led the Fleming Country Grant 1, and this particular grant was looking at surveillance across Ghana. We finished the first phase, but when it came to the second phase, we had some partnership with Aurum, in the sense that we were working together to ensure that the identified Fleming laboratories were refurbished and also brought up to be able to do surveillance work. So that is where we draw the synergy between University of Ghana and the Aurum Institute.
As we look back, in 5 years of Aurum Institute Ghana, we will continue to make impact in the coming years by tapping every opportunity to sustain our gains in the country and focus on leading the implementation of key public health interventions.
I believe that there are other opportunities within the public health space that Aurum needs to take advantage of. Private sector engagement is still weak in Ghana, and so that's an area if Aurum is interested, having implemented the TB case detection in private sector, is an opportunity for scale up.
We need to scale up this innovative, where we partner with the NGOs to scale up our TB preventive therapy as a strategy that the world has adopted. And we need to scale up, therefore Aurum needs funds to do this. Ghana needs funds to do this.
To achieve the 2030 targets, we must first of all attain the 95 by 2025 and attain 90 by 2023. That is next year. What it means essentially that the current 350,000 people living with HIV must, at least 95% must be identified, and then we put 95% of them on treatment.
With our partners, our message to them is that yes, they have been with us along the line since we started 5 years down. They have collaborated with us. Some have shared interventions with us. So we encourage that as the years go on, our engagement and partnership will be stronger. We also say kudos to the government agencies, the NTP and the NACP. They have been wonderful with Aurum, because at the end of the day, we are here to augment the work that they are doing, and they have received as well. And so we would encourage them to continue this partnership with us. Aurum will be playing our part in terms of collaborating very well with the national agencies and also all partners in the TB and HIV field.
To also assure our funders and will-be funders that we are making sure that their funds are prudently managed.
We are very proud to have Aurum Ghana as part of the Aurum Group, and we congratulate them on achieving a 5-year celebration. I wish the Aurum Ghana team all the best for the next 5 years in their journey to becoming a 100-year organization.
So soon, 5 years.
I would want to wish happy birthday to Aurum.
I want to wish Aurum the very best and look forward for more collaboration with Aurum.
I want the staff to understand that Aurum is not Aurum without them. The 5 years have been written by them, each and everyone has played a key role in writing the story of Aurum this past 5 years. I commend the commitment, the dedication, and the love to duty.
On behalf of the Global Board and the Board of Aurum Ghana, I just want to wish you every success with the next 5 years as you work towards your own 100-year legacy of taking evidence to policy and policy to practice to create a healthier world for future generations.
We say Ayiko.